is Amanda Carty. I'm an internal medicine resident at Mayo Clinic.
Hi, I'm Yogesh Kudwa. I'm an endocrinologist here on faculty at Mayo Clinic, Rochester.
We're here today to tell you a little bit about our study. Incidence of type 1 diabetes is not increasing in a population-based cohort in Olmsted County, Minnesota. In this study, we looked at cases of type 1 diabetes diagnosed in Olmsted County between 1994 and 2010. We found 3 unique findings. The first being that the incidence of type 1 diabetes in Olmsted County was not increasing, which is in contrast to other worldwide studies. We believe that our study is robust in the fact that we were able to do a population-based study in the United States, which is very difficult to do. The next point is that we were able to compare the incidence of type 1 diabetes in Olmsted County to that of celiac disease incidence in Olmsted County in a similar time frame. We found that the incidence of type 1 diabetes incidence and celiac disease incidence was very similar. They peaked within about a year, around 2004. So if you'll look at figure 1, you'll see that the trends of type 1 diabetes in Olmsted County between 1994 to 2010 in panel A, that there is a difference in the incidence by age for those diagnosed under the age of 20 versus those diagnosed over the age of 20. You'll also notice that the incidence of type 1 diabetes is different between males and females in panel B. You'll see that the peak incidence for females for age is less than 10, and the peak age for males extends into adolescence. I'd also like to draw your attention to figure 2. This compares the incidence of type 1 diabetes and celiac disease in Olmsted County. You'll see that the incidence of celiac disease climbs and then plateaus. You'll also notice that the peak incidence of type 1 diabetes is roughly within 1 year's time frame of the peak incidence of celiac disease in Olmsted County. You'll also notice that the incidence of type 1 diabetes levels off after year 2004.
And the third point of the study is the fact that over time, the incidence of type 1 diabetes and the incidence of celiac disease seem to be moving in somewhat different directions, with celiac disease probably increasing over time. This study is also unique because it has gastroenterology and endocrinology working together along with our population epidemiologists, and we are increasing our collaboration over the next few years and hope to actually study these 2 diseases more in depth, with perhaps some opportunity to improve treatments in the future. If we have in-depth data from population-based systems such as the Rochester Epidemiology Project, which we've had here at our institution for the last 50 years, then we are able to do studies that evaluate change in the occurrence of diseases over a long period of time, and we can do this with sufficient confidence. And so we built on this infrastructure to make these observations about type 1 diabetes as also about celiac disease.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.